I didn't have preeclampsia. I didn't have any issues. I just spontaneously went into labor. Um, I got put into the hospital at 23 and 5. My doctor blew me off, thought they were Braxton Hicks, told me no big deal, your water's not broken, you're not in labor, don't worry about it, go home and rest. And so the next day I went to my specialist. I was seeing a specialist every 2 weeks because of the type of twins they are. They're called monodi twins, which means they shared the same sac. So basically when you have identical twins, your egg fertilizes and they split after fertilization, rather than like fraternal twins is 2 eggs that get fertilized. So they split after, which put them in the same little sac. So it puts them at high risk. They were being scanned. We were having ultrasounds every 2 weeks, and being scanned to make sure they didn't get something called twin syndrome. When I went into my specialist that morning, I had told her I'd been contracting for 3 days. She said, "Did you call your doctor?" I said, "Yeah, of course. They kind of blew me off." And she said, "I can't believe they told you that, but we'll look." And the minute she put the transducer on my stomach, I knew something was wrong. She just made this face and she was like, well, we're going to look, they look for a couple of things. They look for how much fluid is on each sac of the baby. And then they look for your cervix length, which is what tells them if you're dilated or not, or fixing to go into labor. And she couldn't find it, but she didn't tell me that because she doesn't have that legal authority. The doctor has to be the one to tell you that. So she had started doing stuff, and she got a text message from the doctor that said to go ahead and get weights of the babies. And she said, "Well, I'm going to go ahead and get weights." And I looked at her and I said, "You can't find my cervix, can you?" And she said, "No, I'm sorry. I'm going to have to do a vaginal ultrasound." And I said, "Okay." And when she finished getting weights and stuff, she got the transducer for the vaginal ultrasound. And I just looked at the screen and I said, "I'm dilated, aren't I?" And she was like, "Yeah, you are." And so the doctor comes in and she was like, "Well, I'm going to do an exam to find out," because you can see it. Like, I've never done radiology in my life, but if that's cervix that they're looking at, it was like wide open. So the doctor comes in and she does an exam and she's like, "Yeah, you're dilated to about a 2 right now. But your water hasn't broken yet." So she said, "But you're gonna have to go to the hospital." So I got put in the hospital at 23 weeks and 6 days. Was 1 day away from 24. There's this big stigma in the world that some people say 23 weeks is viable, some people say 24 weeks is viable. But what people don't tell you is that when they say it's viable, it means that they're going to actually try to save your kid. Doesn't necessarily mean your kid's going to live. So I got put in the hospital and they brought down the NICU team to talk to us and tell us our chances of survival at that point. And we were told that Bryce only had a 30% chance because of his weight, and Bruce had a 40% chance of surviving.
And you worked for these babies, right? Like,
yeah,
long time. Like, this was.
I have polycystic ovarian syndrome. Most people know I was married previously, and we tried for a baby for over a year and never got pregnant. And then got with the guy I'm with now. We've been together for 5 years, and we decided we were going to have a baby, and we got 2. But yeah, we worked pretty hard. Like, we were on the brink of fertility drugs at that point. So I got put in the hospital. They did magnesium sulfate to stop labor, gave me steroid shots for their brain and their lungs, and they were able to stop my contractions. And they put me on bed rest, of course, in the hospital. I wasn't allowed to leave. So I was there for 5 more days until my water broke. My doctor came in that morning and told me, you can go home and be on bed rest at the end of the week if you want. Eventually something's going to happen. And I feel like he jinxed me, because about 3 hours later, my water broke. It didn't like break. It just started leaking. I could just feel small amounts of it. And so I had them come in and test me. And she was like, yeah, you know, your water broke. We're going to put you back. They had to send me back over to labor and delivery at that point, to put me on the monitors. And I tell everybody it's a blessing in disguise because my water broke. And then I went to labor and delivery, and I sat there on the monitors for, you know, it was 3 in the afternoon. I sat there until about 11:30 at night, just contracting off and on, and then it gets stronger and closer together and stuff. And then my water broke on the other baby. And when my water broke, the nurses come in there and they said, okay, we have to find them on the monitors because they were so small. We were having trouble keeping them on the monitors. And they couldn't find Bryce's heartbeat. So they got an ultrasound machine. Like the charge nurse came in, and the nurse that was trying to find him looked at her and said, "Give me an ultrasound machine now." And so they got an ultrasound machine, and they went and woke up the doctor because she was asleep in the on-call room. And she came in there, and they were looking. And so they were able to find his heartbeat, but it was only in the 70s, which it should be 120 or higher. So they kept watching him for a while, and he just wouldn't come up. So they said, we're going to take you. They rolled me down the hallway. They did an emergency C-section, put me to sleep. And they were born at 12:19 in the morning the next day, so on a Wednesday. Very small. Bruce was 1 pound 13 ounces. Bryce was 1 pound 8 ounce. I didn't find out for several days, but Bryce was not breathing upon birth. They had to resuscitate him. But he's here now. So we went to the NICU. We spent, Bruce spent 10 days in the NICU in Waco, and then he got a rare yeast infection. We were told that he was not going to live through. Basically, we were given like a 3% chance of him surviving it. Our infectious disease doctor had told us that he had seen 4 cases of it in his entire life, and all 4 cases died. So
that's terrifying as a mother. I mean,
yeah.
You've already been through so much, but.
Yeah. So, yeah, because, between the first day and 10th day when this yeast infection happened, we had brain bleeds, and we had holes in hearts, and fluid overload, things. We were told, I think on 5 occasions, Bruce probably wasn't going to live prior to this infection. So, on his 10th day, he got transferred to Temple, and that's where he stayed for the duration. Then we had to fight to get Bryce to Temple at that point because clearly you don't want your babies in 2 different hospitals. It's especially when they're small, it probably didn't matter so much. Of course, they were critical, but once they started getting bigger and they let you do skin to skin and things like that, how do you choose which kid to spend your time with, Exactly. So we had to fight. Insurance denied us. They said, no, there's no reason for him to transfer. We're not going to transfer him. We won't pay for it. So we just waited. And one day, by the grace of God, his labs were jacked up. Like, he had bad kidney labs. Absolutely nothing wrong with his kidneys, but his labs were just bad. So the doctors used it as an excuse for a transfer. He said, oh, he needs a kidney consult. We need to transfer him to Temple. And so we finally, after 3.5 weeks, got them together in Temple. So for those 3.5 weeks, we were traveling back and forth. We'd see one for several hours, come and see the other, things like that. And, the whole time my husband was working. And I went back to work 2 weeks after they were born, just so I knew when they came home I wasn't going to be able to go back to work. Mm-hmm. So I went back to work, and I would work from about 8 in the morning to noon, and then I would go to Temple and stay there until 7 or 8 at night. We spent a little over 6 months in the NICU. Bruce got discharged after 148 days, and Bryce got discharged after 188. Bruce had, he survived the yeast infection, but who knows how. He was put in quite a few medical journals because of it. And then he has hydrocephalus, which is from his brain bleed. He collects fluid on his brain. So to drain that, they put in a VP shunt. So he has a VP shunt, and he'll live with it for the rest of his life. But beyond that, we don't really know what kind of damage his brain has taken. We know that his brain is growing at this point. The fluid's being drained off. Based on what we see, I mean, he talks, he laughs, he giggles. We were told he would probably never do these things, just because they say that if your brain gets damaged that bad, that you have no quality of life. I mean, we were actually told that a lot of doctors would have stopped treating him because of his brain bleeding. And our doctor looked at me and he said, "I'm not going to stop treating your son just because he may be disabled." And that's, you know, and that's something that we're grateful for sure, because he stands, he rolls. I mean, we have no doubt he's going to walk. He may walk with a walker, he may walk with some sort of assistive devices, but we have no doubt that he's going to walk because he loves being on his feet. He screams all day long, so I have no doubt that he'll talk.
Taking his images and stuff, you can tell he has his own little personality. Like,
oh my God, he's a little turd. Like, he's gonna be that kid that would run up to you, kick you in the shin, and run away and just laugh about it. He's a little turd. Brother Bryce, they had tried to remove his breathing tube multiple times. I want to say 6, and he just could not breathe on his own. He needed the pressure from the ventilator to help his lungs. We're not real sure why. He doesn't have a diagnosis other than the fact that he was just premature. So, gosh, he was about 5 months when they decided to trach him. So he has a tracheostomy. When he came home from the hospital, he was on a ventilator and oxygen 24 hours a day. It's kind of scary coming in, but on top of that, you have to add nursing to your home. So we had to have nursing. We weren't allowed to leave the hospital without 24-hour nursing. And so, hold on, let me text.
oh, you're good. Anytime you need to take a break or if you need to go get the boys or anything.
Oh no. So that's an adjustment in itself, is having nursing in your home, having people in your house 24 hours a day. But he's been home. Since being home, we have weaned ourselves off the ventilator, so we don't use a ventilator anymore. He is breathing on his own. He only uses oxygen when he sleeps. This last week, we found out that he most likely has an airway obstruction, which is causing a lot of his problems. We need surgery, but we can't have it because of COVID. So he also needs some studies done, an EEG, and things, and we're just hanging out. We can't do any of it because of COVID right now. So they've set our appointments for July. They're saying that's how far out it'll be before we'll be able to be seen and have surgery. Until then, we just kind of hang out and do nothing, and we can't make progresses to try to get better. Or anything like that. So, but he rolls. He had a brain bleed as well, but his wasn't near severe. His was only like a 2. But he actually seems, we don't know for sure, but it seems like he has more neurological problems than Bruce does. Mm-hmm. He can roll back and forth like a log across the house. He can sit up with some support. He got him some glasses because he can't see, and we know that he doesn't have 100% hearing. We don't know how much he can hear versus how much he can't. Mm-hmm. But as soon as he's more mobile, they'll put hearing aids on him. But that's just our life now. During COVID, we decided that it was too much of a risk to allow nursing in our house, because my nurses would leave for the day and come back and talk about how they took their kids to the movies or did all these things, and we just didn't feel like it was safe. If they weren't going to stay home and practice the things they should as a nurse, then we didn't feel like it was safe for them to come into our house. I have no doubt in my mind that if Bryce or one of the boys got COVID, they probably wouldn't survive it. So we have to take every precaution we can. The only person that leaves our house right now is my husband. He, if people don't know, we own a fence company, so he installs fences. He doesn't really come into contact with the public. He's out working in a yard by himself. He actually fired his helper for that exact reason, so that he doesn't have to be in contact with another person. So that's kind of our life. We got rid of nursing, so now I'm doing it by myself with the help of my daughter. I take care of both of them, and then all of Bryce's medical needs. He's actually a very stable trach kid, but it still is a lot. I mean, I have to feed him through a feeding tube. He gets medications, breathing treatments. He has to be suctioned multiple times an hour sometimes, sometimes not at all. It just depends on the weather. Weather plays a big factor in his lungs.
So how does that, ask anything and you don't want to answer it, just let me know, but how does that work with sleeping? So do you have to wake up multiple times throughout the night to do the suction?
So in all technicality, we were told that if he's trach, somebody has to have eyes on him 24 hours a day, 7 days a week.
Mm-hmm.
But you just have to do what you have to do sometimes. Yeah. And he's stable. He's never clogged on us. He can clot off with mucus, and that'll be a problem. He's never done that. We've been home for 7 months, and he's not ever done that. He doesn't, his saturations don't go up and down. He's pretty consistent with what he does. So I feel safe enough. I have him, I'm sitting in my bed right now, and I have a pack and play right next to the bed. Mm-hmm. And he sleeps in, and then I have all of his equipment doing work. So I've got his pulse ox, and then that's his suction machine over there. And it just all kind of hangs out by my bed, and he sleeps, and he does really well. I put him down at around 11, and he gets his last feeding for the day at 11. It usually puts him to sleep. Sometimes he'll wake up after around 12:30, and I'll have to get him back to sleep. But then, so whatever time I lay down and go to bed, I set an alarm for 2 hours. Every 2 hours, I'll get up to check on him, make sure he's breathing okay, make sure he doesn't need to be suctioned, make sure, everything's done. And then his earliest med in the morning is at 5:30. So I get up at 5:30, give him his med, and give him his feeding at 7. And then it's just a cycle every day. Sometimes you don't get to sleep because he needs suctioning through the night more than other days. Sometimes I'll have to suction him. I mean, this morning alone, I was laying down while my husband was getting ready for work, and between 7 and 7:30, I suctioned him, I think, 6 times. Mm-hmm. So it's hit and miss. It depends on if I see the weather is kind of crappy outside today, so probably humidity is making him more moist and more wet. With him having trach, he doesn't have a nose, so our nose filters our air. It humidifies our air, and it keeps our air and our airway moist. Well, with the trach, he's bypassing his nose. He doesn't have that. So we have to keep machines on him to keep his mucus thin. Otherwise, it gets really thick, and it's hard to get out. So, yeah, I have to get up several times a night, suction him quite a bit. Some nights you get sleep, some nights you don't. Some nights I don't hear a peep from him for 5 hours. And some nights, every 2 hours, we're doing something with him.
So just the weather plays a big part in that, I'm guessing, like allergy seasons, maybe worse, or?
Yeah, he has pretty bad allergies. He takes Zyrtec and Singulair every single day. It's a prescribed medication. And then weather changes when it gets dry versus when it gets wet versus when it gets cold versus when it gets hot is always playing a factor. Um, Pretty sure that he'll be considered an asthma patient once he's big enough. They don't usually diagnose until they're at least 2 with asthma. But just by the way everything affects him and his breathing, you can just tell, because when the weather gets bad like this, then he needs albuterol treatments because it just affects his lungs. On a typical day, we don't give albuterol, so I have no doubt he'll have some asthma and stuff like that. They're both of the kids are considered chronic lung disease.
Mm-hmm.
And that's one of the big red flags you hear with COVID is if you have chronic lung disease, it's a problem. Hi, is that Graceland?
Yeah.
So they both have that, which they grow out of. They say around the age of 2 or so. So we've pretty much been told to avoid large crowds for 2 years. And then we've been told during flu and RSV season, which we've already been in, starts usually in August, ends at the end of April, basically to quarantine to our house. So COVID is nothing new to us.
I was fixing to just say that. It's just probably scarier, though.
It's scarier and a little bit more precaution just because they're unsure of how it spreads, they're unsure of how long it stays in the air, and they're just unsure of everything. So we take more precautions with COVID than we did with flu and RSV, but we still took quite a bit with flu and RSV. Yes. I have not left my house other than to go to a doctor's appointment or take pictures with you in 7 months.
Wow.
So
mentally, so like, how do you have like a support group or that, like other moms that are going through this to kind of help you? Because I just know even just being a stay-at-home mom, it was hard mentally. So I can imagine the stress of having everything going on.
I have a friend, and you know her. I think you took pictures of her twins once. She lives there in West, and she had 24-week twins. One of them was trached as well. Emily Downing used to be Emily. I talked to her quite a bit. She also works for the home health agency that I use, but I talked to her quite a bit just because she's been through it. She knows what's going on, stuff like that. Beyond that, I work too. I have a full-time job, so I still get paid from work. It's hard to manage, but you just kind of have to. I just keep telling myself you have to keep going. I think I'm still in survival mode. The hospital and when we were getting ready to come home, and now this is just life. I feel like you don't even stop and think, you just keep going.
Because if you stop, I feel like then that's whenever maybe, I don't know, and no one knows but you, because only you're going through it, but I just feel like you're right, you just have to keep on going.
Yeah, because what do you do? What happens if you stop? I mean, you're not going to give up on your kids. You're not going to neglect your kids. You're not going to want them to not have the best life that they can have. So you just keep going to make sure that they do. It's rough every once in a while. I think I've left a couple of times. Like my husband will tell me to go get a pedicure or go do something. It's not very often. I think I got my tattoo, and then I've gotten 2 pedicures since then. So, but beyond that, small trips to Walmart here and there. We get medications and stuff, but not ever just left to go do anything. There's no such thing as date night. There's no such thing as doing anything. So, and on top of that, my husband spends all day outside, especially when the summer comes. He works outside, busts his ass, lifting 100 pounds all day long and 110 degrees. He has no desire to come home and do anything, let alone chase kids around or do things. Of course he does. He helps, you know, if I need him to do something, he'll help me, but he's tired, and it's hard to you know, it's hard on my end because I'm like, I've been stuck here all day long. I've been dealing with these 3 kids. Technically, my 14-year-old's pretty self-sufficient, but I still have to worry about what she's doing and stuff like that.
Lovely teen years.
We have a boyfriend, and
Oh,
we haven't had boyfriend in months now because of COVID, and she's about to go insane, I think.
oh no.
But you know, it's hard. I understand what he does because I've actually helped him on job sites before prior to them. So I mean, I know it's hard. So it's like you both have your heart and you don't know which one. It's hard to balance. It's hard to figure out who's going to do what and when and who needs the break and who doesn't. And it's, you know, you don't want to discredit the other person for what they do. So
Yes. And like, that's why I told you, like, you're so tired of me saying, oh, I just praise you, girl. I just praise you. But I always feel so bad because, like, if I'm complaining or whatever, and like, you just come to my head, like, Sharla, why are you complaining? Like, why are you complaining? Like, I mean, there's me and my husband, like, yeah, we've been stuck in this house. We haven't had a date night, but that's like your life right now. I mean,
yeah.
and
So when we were in the NICU, there would be people who would come in. There would be people that would come in the NICU and their kid would be there for, you know, something small like diabetes, gestational diabetes. Or their kid would come in as a 40-weeker and be there for 3 days or one night. And parents would just lose it. And you'd see them just bawling their eyes out and whatever. And in your head, you want to be like, man, you don't even know. Like, that's nothing. You should be excited that your kid's here for one night. But then at the same time, I've learned that you can't take anyone's experience away from them because you don't know what it's like to be in their shoes, number one. But number two, my kid had the worst. We were in there for 6 months. That was our life.
mm-hmm.
If you had a kid that was in there for a week or 2 weeks or even just a couple of days, that's still hard on any mom. It doesn't matter if it was 6 months or one night. Because if your kid, let's just say your kid was in there for, and I think you told me one of yours was in for a little bit, right?
Yeah, for 2 weeks.
So your kid was in for 2 weeks, and that was hard on you.
Yes.
You don't know what it feels like to be in there for 6 months. So of course, like, you've never been in the other person's situation, and what's hard to you feel like is awful because you've never experienced a 6-month stay. You don't know what that's like. And so it's okay. That's what I've learned. It's okay for them to be upset. They have every right to be upset because it's
and that's amazing. The way you look at stuff. Like, I'm just telling you, see, like, I didn't think about it like that, but yes, I get what you're saying. That's an awesome way to look.
Because you don't know what other people's struggles are. Like, I can sit here and say, oh, my back hurts so bad. I have every right to hurt. My husband can say, oh, my back hurts. Mine's way worse than yours. Yep, it probably is. But I don't know what yours feels like. So until I know what that feels like, mine hurts now, you know? You just have to, everybody lives the life they have, and we can't discredit others because they haven't experienced what you're going through. It's not their fault. They've never experienced it. So
yeah, that's true. And that's why you're humble and everything. Do you have a picture of the boys that everybody can see, or?
I have a bunch of pictures.
I'm not tech savvy. I was gonna like try to pull up one in this Zoom, but I don't know.
Yeah, I've never done that. So we do therapy, all of our physical therapy. So we have therapy every single day of the week, whether that be speech, physical, or occupational, and we do it all on Zoom or FaceTime. These are our Easter pictures. They're not my favorite.
So have y'all got to see any family, or do y'all just, I guess not, because.
Not really. So we were outside playing at Easter, and my
Okay.
parents drove by, kind of hung out in the street while they talked to us. Um, but we don't ever get to see them. Like, nobody's really held them or been with them or seen them in months. So this is them on Easter.
And they just have the perfect personalities. I could just like sit and talk to them all day long. Like I'm like, whenever this is over, if you ever need a break, I'll be like in a hazmat suit and I'll just come talk to them.
Bruce he's interesting for sure, because he'll just lay there and scream for no reason. So they are, let's see, they're almost 14 months now. It's crazy.
And what did the doctor say? Like, did they give y'all like, because you said something like they weren't supposed to make a year or whatever. So
now they're fine.
fine.
They're expected to live their fullest life. You know, whatever happens because it happened, not because they're at point. Bruce will have the shunt forever. He may need it revised at some point because, of course, we all grow. And so what they do now is that it goes in his brain, and then it goes down the side of his neck and down into his stomach cavity, and it's coiled up in there right now. And so as he grows, the expect is that it uncoils and it stays in the same place, but there's not 100% guarantee that that'll happen. So as he gets bigger, he may need it to be revised and redone. Bryce, their hope is always to get a trach out by the age of 2.
Mm-hmm.
Because of COVID, I don't think that's going to happen now. We're 14 months now. We're not even going to get to have our first appointment is for July 1st, and that's the day we'll go in and sign consent. And then they'll go in and scope him July, August maybe, find out what's wrong, and then they'll have to go back in and repair it after that. So another surgery. So, I mean, we're talking almost 2 at that point, because then once he's repaired, then we have to start, it's called capping the trach, where you just close it off, plug it off so that they can't use it. Teach him to breathe in his mouth and nose on his own. And then typically a pulmonologist will not take a trach out in the middle of flu and RSV season. It's just too risky, because if they take it out, it closes up, and then he were to get RSV, and then they can't manage him with just a normal tube. At that point, they'd go back in and put a trach back in. So it's just too risky. They usually wait until the season's over, and he's not at risk for that, and then they would decant at that point. So I'm thinking closer to 3. We might get it out, as long as everything goes well. He doesn't swallow right now, and he doesn't do a lot of things normal babies do, but we're wondering if it's his obstruction, if it's his airway obstruction, because when he lays down, it's worse than when he's sitting up. So if there's an obstruction there, it may be causing him not to be able to swallow and not be able to breathe effectively, and need the more support at night, which needs oxygen at night. So we're hoping that solves a lot of problems when we get to have that surgery. Other than that, he will probably be the least likely to walk. They think he will be able to, but they're just not sure when and how walking will look for him. He doesn't like weight on his feet. He doesn't do that, and that could just be a delay in growth. I've noticed from the time we came home, Bryce is anywhere between 6 and 8 months delayed behind Bruce on doing things like, babies look at their hands. Babies put their hands together, they grab toys, things like that. And he's been delayed the whole time on doing that. Like right now, he still has no interest in toys. Like he likes to look at lighted toys, but he has no interest in picking up and playing with it. Whereas Bruce does. He picks it up, puts it in his mouth, plays with it. and things like that. So we don't know what his future looks like, but it doesn't matter. I mean, he's alive, and he knows us. He knows his name. When we talk to him, he knows we're talking to him. He'll look straight at us and smile. He just started smiling about 2 months ago, and he will now, and so you can actually see some emotion on him. So,
and I bet that's just awesome to see that, like, for you, like, for them to go through all this, and you just to see that every day. Mine are flying in the background. I don't know if you can hear that.
Oh, sorry. I was trying to find pictures that you took, but I can't find them.
I don't know how to pop them up.
It's amazing how when you have kids, how much phone memory you use.
I know, like, mine's always telling me I need to
Mine won't even download apps anymore because it's
I know, mine either. I'm sure there's something out there. I'm gonna find it, like, that I could just send my phone or through cloud or something, and they just make me an album of everything that's in there.
Well, it can, like, you can do that, but even your
But I'll
cloud
have
gets.
to sit there and do it.
Yeah, well,
Amazing.
you can offload them onto computers and onto hard drives and all that all day long, but then I'm like, but I don't have access to them, like, right away. I can't look at them.
Yeah, that's true. And I'm always going back. And even the girls, they love to go back. Like whenever we went to Disney or any, and just kind of you forget what you go through until you go through your pictures on your phone.
Yeah, when they're 3 and they want to know, you want to show them pictures, and I have to go find them. Sorry, kids. Like,
Yeah. So your oldest?
14.
14.
She'll be 15 next month.
Oh my goodness.
Here's you. Well, that's the wrong one. You obviously have seen these. You took them, but for anybody else, these. Can you see it?
It's kind of blown out. Wait, it's coming. There it is. Yes.
So these little dolls that they're holding were their true birth size and weight. So they were about 12 inches when they were born. And then I know it's hard to really fathom what 1 pound and 1.5 pounds is, but they were the size probably of a grown man's shoe. And that's about it.
So whenever you had them, did you get to hold them at all right away?
Nope, I was completely asleep. I was under anesthesia completely. They woke me up in recovery and they said, your husband's on his way in, and I saw him, and the first thing I said are, where are my boys, and what, how are they,
Mm-hmm.
And he said they're in the NICU, but he hadn't gotten to see them at that point. Typically, even when they're critical like the boys are, they take the dad up to the NICU, but they didn't because Bryce wasn't breathing. And they just weren't sure what was going to happen in the transport, so they didn't want dad to go with him or with them. So dad got to go see them at 3, so they were born at 12:20. Dad saw them about 3 in the morning when they took me to my room. And then I was told I had to wait 12 hours to get out of bed. But the next morning, about 5 in the morning, I asked the nurse, and I said, when can I go see my kids? And she said, later this morning, when your next nurse comes on, after report and stuff, they'll let you get up and go see them. And I said, okay. And immediately, I was half out of it, but the first thing I wanted to do was pump, because I knew how important it was for these kids to have breast milk. If I couldn't produce breast milk, they would give them donor milk. Breast milk is one of the most important things for a micropreemie, because otherwise they're at high risk for it's a small intestine infection called NEC, and basically at that point, if they get it, once they find out they have it, it's too late and you lose part of your intestine. So At 5 in the morning, I'm sitting there. I got woke up from recovery and put in my room at 3, and at 5 in the morning, I'm pumping, trying to get milk. So that next morning, the day shift nurse came on, and I asked her if I could get up to go see the babies, and she said, "No, you have to wait 12 hours from your C-section." And I looked at her and I said, "That's not happening. I'm not waiting 12 hours. You're going to get me out of this bed." And she said, "I'm sorry, you can't get up." And I was upset. And about 5 minutes later, my doctor walks in, and I looked at him and I said, "Can I get up and go see my babies?" He said, "Yeah." He turned and looks at the nurse. She said, "Get her catheter out. Get her catheter out and get her up now."
Wow.
And she said, "Okay." So he talked to me for a little bit, and then he left. And the nurse came over to me, and she was like, "Well, I'll take your catheter out after you go up the first time, just so I can make sure you're going to be able to get out of bed and go pee." And I said, "Okay." And she's like, "Well, let me go get a wheelchair." And she goes and gets a wheelchair, and she brings it to the bed, and she's getting it all situated, and she's facing away from me. Her back's to me. She's putting a blanket on it, because we all know we're bleeding like 9,000 times of heaven. And so she's putting all these pads and stuff on it. And as her back was to her, I was sitting up on the side of the bed, and she was like, "Whoa, whoa, 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 you need help to get up." And I was like, "I'm fine." And she was like, she said, "I have never in my 15 years of been working here seen anyone have a C-section and get up the way you just did without help." And
That's
I was like,
ready to see those babies.
that's what I said. I said, "You're not getting myself." I stood up and I sat there and I came back down. She's like, "Do you think you're going to be able to get up and go to the bathroom?" And I was like, "Yeah, I'm fine." She's like, "Okay." So she finally pulled it out. But so they were born at 12:20, and it was about 9:30 the next morning. I finally got to see them. I didn't get to touch them. You don't get to do that. Their skin is really, really thin and fragile. I finally, I think, got to touch them that first night. It was probably like 7 or 8 at night. And all I got to do was just put their little fingers around mine. That first night, Bruce had a really large hole in his heart, and the medicine that they used to close it causes brain bleeds. Well, his brain was already bleeding, so it made it worse. And that was one of the hard decisions. The first day of life, and your doctors are sitting you down telling you need to make a decision to give him this medicine and make his brain worse, or just see what happens and probably let him die. It's a no-brainer at that point. We said, just give him the medication.
Yeah.
So they did, and of course it made his brain worse. I didn't get to hold him though, because he was so critical, because the doctors looked at my husband. He wouldn't tell me. Told my husband and said he probably won't make it through the night. And they said, "Well, if you want to hold," it was the first time I touched Bruce. They said, "If you want to hold his hand, you can." So I held his hand and just talked to him. And then, if you truly, I'm kind of breezing over a lot of this stuff, but if you truly heard everything, I've heard so many people tell me it sends chills down them. Because the way everything happened was, there's nothing I can explain other than God. Literally, that's the only thing. But so we told the doctors, we said, "We're going to go downstairs and get something to eat, and we'll be right back." He said, "Okay, but do not leave the hospital." He was talking to my husband. Of course, I couldn't go anywhere. But so we said, "Okay." And he said, "And we want y'all to come right back," because they were worried he was going to pass on us. And so we went down and we got something to eat. And we came back up, and they drew, it's called a blood gas. They draw to check his respiratory status. And they looked at it, and the doctor said, "Are you sure you drew this on the right baby?" Thinking that they drew it on his brother instead of him. And they were like, "Yeah, it came from him." And he was like, "Okay, well, I guess he's going to turn this around." And literally, almost within minutes, flipped it around, and he was doing better. I wouldn't say good, but good probably compared to what he was. And everybody just says it's because they let you touch him, and we don't really know. But that's what I was saying earlier about the whole, I'm glad my water started leaking on Bruce before my water broke on Bryce, because When my water leaked on Bruce, they sent me over to labor and delivery, put me on monitors, and then when my water broke on Bryce, his heart rate dropped and then eventually stopped. So had Bruce's not started leaking, I wouldn't have been in labor and delivery. I would have been in postpartum, and they don't have machines to monitor you in postpartum, to monitor heartbeats and stuff like that. So it's just kind of like a big snowball effect. Like, had Bruce's water not started leaking, I wouldn't have been over here to save Bryce's life, and it was pretty crazy.
It's amazing how it all works out. Like, I could just talk to you all day long and just hear it over and over again, because I just think it's amazing how it all, and then these babies, like, everyone should meet these babies. I know obviously they can't, it's scary right now with everything going on, but just like the personality and just watching you in the studio that day, how you just do it. Like, you just do it. Like, do what you need to do and keep on talking. Like, it's just second nature for you, and it's just amazing to watch that.
But if anybody else was in the same position, they'd do the same thing. You just have to. I remember I worked in a hospital. I was a CNA for 6 years, and I remember patients that had to be suctioned and had like their suction canisters of snot and stuff would always gag me up. I was like, that's the one thing I can't do. I can do poop, I can do pee, I can do vomit, I can do it all, but I could not do mucus and stuff. And I think it's funny now because God just threw me into a mucus child and said, here you go. You know?
You said, you watch this.
Your kid, it's the saying that kid, if your kid throws up, you're going to be like, okay, cool. If my kid throws up, you may freak out. You're not going to clean it. But if it's yours, yeah.
Alrighty. Well, thank you so much for sharing your story. I could talk I could talk to you all day, but I know you need to get your day started and get them ready and everything. So I won't keep you very long. But thank you. And anytime that you need to chat or anything, feel free.
All right. Thank you.
Y'all have a good day.
You too.
Bye.
Bye.